and you see no food. Oh God. My whole life changed. I was a madman in clean clothes. I know diabetes take over my body, and I wish this one not even to my worst enemy. Listen to what the doctor said. Rasta man, I tell him this. I heard man, they make me lose my foot. And then me father stop take the doctor medication and I take for the medication.
In Office with Dr. Jevon Samuels.
Good day viewers, welcome to another episode of In Office. I am Dr. Jevon Samuels and today we'll be discussing type 1 diabetes, and in office with me today I have Mr. Major Mackerel, a well-known recording artist.
Yes, Major Mackerel musically, biologically, Garfield Dixon.
Good.
Yes,
Alright,
sir.
thank you sir. Alright. So as I said before, for in office we will discuss life, sickness and death, and today's topic we'll be discussing type 1 diabetes. Type 1 diabetes is an autoimmune disease in which the body's immune system attacks the insulin-producing cells of the pancreas, which results in the inability of the body to reduce blood sugar. Whenever we have the body's immune system destroying the insulin-producing cells of the pancreas, the body loses its ability to move glucose from inside of the blood and into the cells. This leaves the body cells starved for energy and normally the body cells would break down the fat stores and the glycogen store and try to produce more energy for the cells. However, the diagnosis, whenever a patient comes in with these symptoms, which we call urinated polyuria, polydipsia, polyphagia, which is just saying feeling hungry, thirsty, urinating a lot, then we normally would do a urine test to test if there is any sugar in the urine, and also we should test the blood. Now the blood test to diagnose diabetes, we normally use the oral glucose tolerance test, and that's a test if we have a blood sugar above 11.1 millimoles per liter, then it's diagnostic of diabetes. Also, any random sugar that is above 11.1 millimeters of mercury is also classified as diabetes. And if the patient have a fasting blood sugar of above 7, it's also classified as diabetes as well. We have type 1 and we have type 2 diabetes, main types, and only 10% of persons with diabetes have type 1 diabetes. And it has nothing to do with the type of diet they eat or how obese you are or your lifestyle. It's just an autoimmune disease in which the body's immune system actually attacks this insulin secreting cells of the pancreas, which then results in the body's inability to regulate the blood sugar. Risk factors: if you have a family history of type 1 diabetes, then you are at increased risk of getting type 1 diabetes. Also, it tends to be more common in persons that are further away from the equator, so mainly persons in the temperate areas have several complications. So persons can have severe cardiovascular complications, they can have an heart attack, they can have a stroke, they can also have issues with the eyes, so they can end up have diabetic retinopathy, which can lead to blindness. Some persons also develop what we call peripheral neuropathy, in which the nerves in the limbs are not functioning, they're unable to feel pain or even touch. And some may develop leg ulcers as well, right? And also diabetes can lead to kidney failure, in which persons have end-stage renal disease and have to be dialyzed. In terms of type 1 diabetes, there is no really means of preventing it. It's an autoimmune disease, so anyone can just simply, the body immune system can malfunction and damage the pancreas, and hence you're unable to produce insulin. Now, my guest here, Major Mackerel, welcome once
Yes,
more.
sir. Yes, sir. Respect, sir. Good
Yeah.
evening to you,
Yes,
your staff, your crew,
yes.
everybody, you know.
Alright, thank you. At what age you were diagnosed with diabetes?
I think age 23.
Alright.
Yeah, 23,
23.
1990. You know?
1990, so that's some 30 plus years ago,
34
years ago. Okay. And what were some of the symptoms you were having at the time of diagnosis?
Well, first, I couldn't sleep at night. Second, frequent urination. Since you introduce yourself and introduce the story and the topic that we're going to be discussing today,
Yes.
within that minute and a half, 2-3 minutes, I would use the bathroom 2 times already.
2 times already?
Yeah.
Okay, so it was...
And I realized I keep wanting sweets.
You're craving the sweet?
Craving for sweets. That is the only thing that tastes good.
Okay.
And the next thing, within 1 week of frequent urination, craving for sweets, my eyes them sinking on my head, I realized me I lose a lot of weight.
A lot of weight.
Alright, because I used to weigh 260 pounds.
Yes, and then about how much weight you lost at that
Right.
time?
At that time, I would have said I lose 25-30 pounds in 1 week.
In 1 week?
Yeah.
Oh, that's significant.
But it's just, I never know what happened to me. Alright, my father, diabetic, died from it. My mother died from it. I have 4 uncles, 3 uncles that died from it.
Sorry to hear, but it
And,
must be traumatic.
but me never knew.
Definitely.
Because at that time, me a young Major Mackerel in studio, touring the world, mashing up the places. What is diabetes, you know?
Okay.
And I was like, no. But then I realized me I lose weight. So on Saturday morning, same place on Reynolds Road here.
Same place on Reynolds Road?
There was a doctor right up by Lee Supermarket,
Yes.
across the road. His name was Dr. Smith. The building is no longer there, but there was a doctor office there.
Yes.
I went to Dr. Smith that morning, and outside was a man selling cane and jelly, oranges, and he was a fruits man.
Yes.
And he juiced the cane. So I go so boom and order some cane juice from him.
Yes.
And I drink the cane juice. I wake up back in public hospital,
Public hospital?
Yeah.
Was you blocked out?
passed out.
Okay. And then...
So when I wake up now, I was like, what me I do here, so? Because when I wake up, I had tubes in my nose.
in the penis?
Yeah,
and
in the
access.
penis. Yeah, all access. I had a tube.
Okay.
So, we stay so and I said, what's going on? And I said, Mr. Dixon, you are diagnosed with type 1 diabetes, and we would like a family history.
Yes.
So I called my mother. She was living in Canada. She's died now, rest in power.
Alright.
Now that's a peace. Now peace is
Oh.
rest in power.
Alright. Sorry about that. Alright.
And she talked to the doctor and tell them, and I start with insulin
Yes.
from 1990. And over the first year and a half, 2 years,
Yes.
we get comfortable with the needle.
Needles.
I could juke myself anywhere with the needle. And
Alright, so back then, sorry to cut you, but in terms of the insulin, like how often for the day you have to stick yourself with the insulin?
I had to stick myself 4 times.
4 times.
Yeah, because I use 2 different insulin.
You know the names?
I think one was Lantos,
Yes.
and one was regular.
Regular, okay. The regular is before meals and the lactose at night. Alright.
Yeah. And I take the medication, do what me I do, and eventually, after a period of time, I said, well, can't deal with this no more.
Yeah.
Too much injection.
So you had to stop taking the
So
medication?
I start take the medication and start eating less.
Okay.
In other words, I only eat to survive. Alright?
So, but they must have been losing more weight with that method?
Yeah, man, and that's when I realized that I was at Club Amazura in New York on stage,
Yes.
performing. And I don't know what happened. I wake up in
Hospital?
the hospital.
Oh.
The hospital, Jamaica Hospital, in Jamaica, Queens.
Okay.
Alright?
So what were you diagnosed with at the hospital? It was diabetic ketoacidosis, because that's one of the complications of type 1 diabetes. You know, normally they can go in diabetic coma, severe acidosis. Some persons even admit to ICU.
Yeah, you know, I never have nothing like that, or if I had it, at that time, I didn't question it.
Okay.
Alright, I don't know the abbreviation of a lot of these medical terminology,
Okay.
but I don't know, but all I know, diabetes take over my body, and I wish this one not even to my worst enemy.
Okay.
This diabetes is a silent assassin.
Yeah, you can just imagine. Now, I know that you're an entertainer, so you tend to be like traveling from city to city, country to country, and you would have to be having the insulin and fridge or ice. So how did that process? You were able to take it whenever you're going to
When I'm, for example, if I'm leaving Jamaica, I go to have my doctor, and the right officer, patient Garfield Dixon. He's diabetic, he's under my care.
Okay.
And they give me the medication to travel with.
Okay.
So you pass custom, you pass immigration, you're alright, but when you reach a custom want to know what you have. And so the letter verifies so that I am sick, insulin-dependent.
Okay.
And I don't know, if it was my lack of attention, but I know people that start with insulin and end up with tablet.
Okay.
I stay with insulin.
Alright, the thing is that sometimes some persons, when they're diagnosed initially, they probably think it was type 1, but sometimes it's type 2. But normally type 1 patients, because the pancreas is normally damaged and not producing any insulin whatsoever, you have to be dependent on insulin, dietary changes and exercise. So tell us about like some of, if you have any exercise regime or dietary changes that you take.
I'm gonna be real with you. On the dietary part, the only thing I don't do is eat nothing that come out of the fridge.
So you don't eat any...
Nothing. As long as it go in the fridge, I don't want. The only thing I use out that's in the fridge is the insulin.
Okay.
And
but say eat meat, I eat meat or I don't eat meat?
I have to eat meat.
You have to eat meat?
Yeah, I have to. I need the protein. I never used to do it.
Okay.
I'm a Rasta man, and one time I was very religious.
Yes.
When I'm saying religious, I mean very, very religious, that I think doctors was butchers, that I didn't think that them teach me.
Okay.
And burn out the doctor, and burn out this, and burn out that. And it's a big joke.
So how did you develop that belief? Is that the person that you had lived with have similar belief that...
I was around some Rasta man in New York City.
Yes.
And our philosophy is repatriation back to Africa.
Yes.
And that was my intention, my focus till the guy, a brethren of mine that lead the house, he gets sick.
Okay.
And I get sick.
Yes.
They give me roots and they take him to the doctor.
Really?
So I said, no sir, I'll go to the doctor, go check it out for the first time.
Alright, so tell me that story straight. So the leader for the house.
Yeah.
So when you are sick, they give you roots to
Give
heal
the
you.
roots, and so the roots will take down the blood sugar, and the one will steadily.
Okay, so they have the roots for take it down
Yeah,
and stabilize
it.
But when he took
When
sick,
he took sick, they take him to the medical doctor.
so they didn't try with the roots.
So I asked them if the roots only work for me, and the roots never work for the man.
Okay.
His name is Bongo Blackheart.
Okay. Alright.
Alright? And I have to go to the doctor, and the doctor looked at me and said, Mr. Dixon, you're anemic.
Your blood count was
Alright?
low.
Your blood count low. You don't have no protein, no iron in you. Alright? Him say you have two choices. Continue and have a short life, or you have to start eat something with protein, with blood in it.
Blood, okay.
I don't eat pork, and I don't eat cow.
Cool.
So I end up with chicken and fish,
Okay. Alright.
or anything from the sea.
Alright. So in terms of the exercise now, you have an exercise, you had an exercise.
No, not then. I don't have an exercise routine. I'm not gonna lie. A lot of people tell lie. I'm not gonna tell no lie on the medical. I don't have an exercise routine. I don't not exercise. I don't work out.
Yeah.
But when I do exercise, it's in the studio.
Okay.
I do a lot of double plate at daytime.
Okay.
And so I sweat a lot.
Okay.
And what about that sweat? It's not like I'm running or I'm walking.
Yes.
I'm standing one place, DJing on the mic, and I develop a natural sweat,
Okay.
which is really helped me a lot. You know?
Okay. Alright, they're active. Now, in terms of like relationship wise, know that sometimes some persons that are sick tend to have issues with relationship, like the partner, probably not so cooperative.
I never tell the world, you know. I never lie to the world. But they are 80%, you know, 100. Failure is not my option, and I don't reach failure yet. But where I would like to be, I am not there.
Okay.
Alright, I'm 34 years taking 4 injections for like 15 or 20 years. No, for like 25 years, and after that, they dropped it down to 2 injections.
2 injections
Per day.
Okay. So you also test you have a blood glucose?
Yeah, I have a blood glucose machine will test my sugar. I don't test it every day. For example, this morning I didn't test it.
Okay.
Alright, but I have diabetes so long that's my mouth give me a taste, like when it's high, when it's low,
Okay.
and my body give me the symptoms. Every day as I talk to you and you look, this is sweat start coming.
Okay.
That means it's low.
Okay, good.
Alright?
Eat
When
something
it's
sweet.
too high, you have to go walk around the block 2 or 3 times and bring it down back a little bit.
Okay, so you get to understand it.
I understand it a little bit. I don't understand it fully. But all I am telling you is that I don't wish this thing on nobody.
No, understandable. Alright, next thing I want to ask you about, since you have been overseas for probably half of your life, or more than half of your life, and be in Jamaica, so you would have a comparison of first world healthcare versus third world healthcare.
Well, the first world healthcare is more advanced than the third world healthcare. For as you know, you live in Jamaica. The people of Jamaica
Yes.
we are the one that the young doctors train on. Alright?
Yes.
So, in America, there is a lot of training doctor, but there's not that much active in the hospital.
Okay.
Like how they are active
In
Jamaica.
Okay.
And one of the reasons for that is because Jamaica has one of the hub, one of the schools that teach, UE,
Yes.
UWI, they teach you how to be a medical doctor in
Yes.
Jamaica from scratch.
Yes.
So the training doctors, you know, sometimes people have problem with the training doctor because there's a lot of training
Experience, yes.
and experience. But the reality of this situation is that, you know, you have to creep before you walk. You have to before you talk.
Yeah, that's right.
And, you know, so, but in terms of the medical, the advanced, there's advanced medical in the foreign system.
So give me an example. Like they have, I know they have like the insulin pump that they attach there, but have you ever used that before?
No,
It's
I
just-
just take the needle. I get used to the needle now that it's in my car outside.
Okay.
Alright?
I know that in America they're doing like even pancreas transplant.
Yeah.
You ever introduced to that surgery?
They offered me something like that, you know. I tell them, say, you know, me are not chicken. Alright? But eventually, right now, this is a prosthetic leg, you know.
Yes.
I lost my leg through diabetes, poor circulation, no blood going in there because a lot of people don't know this. Your heart pumps blood through your body.
Yes.
And the furthest point from your heart is your right foot.
Okay.
So that's the last place on your body where blood reach. So it's the first place to go by.
Okay.
If you notice, most diabetic people, they lost the right leg before.
Okay.
And that is because of the heart pumping the blood, but the right leg is the furthest point from the heart.
Okay.
So it's the last place to get blood and the first place to get blood.
But alright, so you can tell us about the story behind you losing that leg.
Well, me a ninja man, you know, Major Mackerel, ninja man, my
Yeah.
brethren, you know.
Yes.
Me and my brother and sister, but I'm me and the brother. I'm just being joyful. We was racing on Breadings Road because me know me could run fast on him.
Yes.
And me and him a race. I win the race, but I run out of my shoes.
Oh.
And something stick me in my foot bottom.
So you didn't see medical attention?
Yes, I did. But after 2 days, I see it dry up and all of that. The doctors then give me 2 weeks worth of medication and I take it for 2 or 3 days.
Oh, antibiotics?
Yeah.
Okay, so you're in compliance with the...
And 2 or 3 days, couldn't get better. As a matter of fact, I thought it get better.
Okay.
But then, you
So you
know,
weren't feeling any pain because
No
right now the
pain.
diabetes would have damaged the nerves.
yeah, I never feel no pain in it. And I used to feel the regular diabetic sticks.
Yes.
There were times when coming like a high speed, somebody stick you with it in your foot.
Okay.
Or somebody just screw a screwdriver in your foot. The
That's
diabetes, yeah.
Sticking pain.
Yeah, a sticking feeling there. And me not pay no mind. My girlfriend looked at me one day and said, Garfield, you know, see your eyes them yellow. I said, what do you mean by that? She said, the white part of your eye, them look yellow. Them don't look white as what it's supposed to be.
Okay, so you didn't feel sick within
You
yourself?
never feel sick, and I'm doctor, I'm going to tell you this, because normally you're a medical doctor.
Yes.
You make plans to do surgery, right?
Yes.
I never make no plans. I just go medical associate.
Yes.
Dr. Wright, Dean Wright, draw some blood from me. I'm going to test the blood and come back and say, Mackerel, you have two options. You go home, you'll probably die or you lose the leg. Because I just go in the doctor go visiting me.
Yes.
Because my high and I feel good. I'm saying the whole body poison.
Oh. So how you took that news at the time? You made a decision, you agreed with the decision initially?
No, that's at the Wednesday night. Wednesday night like now, around 7:30 like
yes.
now. And the doctor said, what you decide to do? Because this test here when you see,
yes.
I don't know what kind of test.
Okay. But you just know say you saw something that
and him said, this test here show me so that your body is infected and it's infected through your foot.
Okay. So your foot didn't have any pus draining from it, nor like
no,
it's black,
like
or black or smell.
But here are no. I never have no feelings in it. And the outside the heel and inside I get bad.
Okay.
Affected bad. And because I have no feelings in it, I never know, and naturally I never know.
Okay.
And then at that time, I'm still young artist, run up and down same way. We still think me better than diabetes. We still think it cannot control me.
Okay.
And the doctor looked at me and said, you can either go home
or you take the leg.
Take the leg.
Alright.
And I look at him and I say, how much money for do that? And him say, in terms of money right now, I know you can't pay for it one time.
Okay.
But I want to see it though. So I will set up a plan.
Okay.
See? And set up a plan, and that was a Wednesday night. Then carry me go theater the Thursday morning.
Okay.
And I go in the theater the Thursday morning, and I remember them all hooked me up. And wake up back now around 4 o'clock Friday morning.
Yes, with one leg.
And I draw the tube out of my nose. They have a tube in my nose.
Okay.
And I pull it out back. When I look at me, I don't see no foot. Oh God. My whole life changed.
Yeah.
I was a madman in clean clothes.
Okay. So which age you lose the leg?
6 years ago, 6 years ago.
Recently?
Yeah, recently.
Okay.
Yeah, man, for the last 5 years, it's like I was just floating and thin here,
Okay.
But eventually, I learned to accept that it's not gonna grow back.
Okay.
And I learned two things. It's not gonna grow back, and I will not be the same Major Mackerel on stage with a mic in my hand.
Okay.
That's the only thing I know, Doc. I don't know nothing else. We try carpenter, then run me off of the works and lazy. We try construction, then the only thing me know is a mic in my hand and an audience in front of me.
Okay.
And mentally, it destroyed me. Manipulate my mind for 1 heap of years.
Okay.
It made me chase away some good people from around me.
Okay.
And it made me chase away some bad people from around me.
Okay.
At that time, 3-4 years ago, I was a man just living without a brain. Alright?
Okay.
And I'll tell everyone, take care of yourself. And anytime a doctor look at you and say, you're diagnosed with this, take it serious.
Don't live in denial.
Because never take it serious. And I never respect the doctor the way I was supposed to respect the doctor as a Rastafarian. See, and I used to burn out the doctor and say, doctor, you know, I'm a butcher, I'm a human butcher. I don't want to cut up people and go in at them and do this and do that. But the reality of it is this, you know. You have the medical experience.
Yes.
I have spiritual experience. The physical always be spiritual.
Definitely.
Alright? So me I tell the people when I listen to the doctor when he talk to them, see now in a complication you don't have anything, diabetes, acid reflux, gastritis, whatever the disease is named, hypertension, blood pressure, whatever is a sickness name, just make the doctor let know and follow their protocol.
Alright. Well said, Major Mackerel. Alright. In terms of, say, have the diabetic foot complication, the lactolem and the neuropathy, you didn't have any other complications like kidney failure, kidney issues,
none of that.
with the eyes?
Yeah, right now, I'm going to be real with you.
Yes.
My eyes are getting blurry.
Both of them?
Both of them.
So you have been to the ophthalmologist?
No, not yet. Alright?
But a part of the management should have been a yearly visit or at least every
Yeah,
year
yeah,
to the ophthalmologist
yeah,
the laser that they use. So
that is scary because when you put the laser after that, there are a couple of people who do that and they end up blind after that.
Okay, so you have that fear as well.
Me have a little fear in me for that,
yes.
But it's something that I want to do.
Okay.
But me just have a little fear in me for it.
Alright. So recently you're still able to tour though and perform?
Yeah man, still perform. You know, last night I was at Dancehall Thursday.
Okay,
you know?
good.
Me only famous Peter Mitchell because that's our platform. The three of us run that platform. Only who own the platform,
yes.
Me and Peter Mitchell work with him.
Alright.
And you know, it don't stop me musically, physically, sexually I still can do what I do.
Alright.
But I'm not as good as I was.
Okay.
But I still, and realistically speaking, life is great, all right? But it's you have to make it great as a diabetic.
Okay.
And I have no kidney failure, nothing like that. I have I don't know if it's a disease they call gastritis.
Gastritis, okay.
When
So severe it is, you have to take pain medication or have hospital admission?
yeah man, in the hospital admit
Admit? Okay, for the gastritis.
in the hospital
How long you normally spend in the hospital on average?
5-6 days,
5-6 days. Okay.
7 days.
They never actually done the surgery though, no surgery. No, except the lip, not on the stomach.
No, I never had no surgery. I did 2 surgery. This at Kings County.
What had happened to your hand there?
A man attacked me with a sword, you know.
Oh, the trap you get there.
Yeah, a man attacked me with a sword. So I did this surgery at Kings County Hospital in Brooklyn. And I did this one at Natal Hospital
Here.
here in Jamaica.
Alright, when I was telling some of my colleagues at the hospital about you being here, the only thing they can remember that you have a unique sound, that you are the only one that can make that sound perfect.
Yeah man, it's a old school DJ where a lot of people
Alright,
go listening to.
And then since our entertainer, DJ and in office today, you want to just sing a hit song for the viewers from the past and a new song that they have?
Well, this is my first hit song, #1 song.
Yes.
Otochi dan ban kya roshi champion, Otochi dan ban kya roshi, Otochi dan ban duna roshi champion, Otochi dan ban. Then we sing rondong man, gyal rondong man, nobody rondong man. And then we sing another song, Miss Getty Getty gyal, you only man. And Miss Wanty, Shaka Zulu, them favor Shaka Zulu. They looks done and they not get none.
Yeah, man, everyone know that.
Yeah.
Right? And then the new material they have now, they can tell the viewers how they're
Right now we have a new song named Number One just released. And a song now preparing to release by the name of Happy Like Holiday. The real name for the song is Holiday. And I have a next song that named Happy. That's 3 songs I would like to release with the back in the studio record again.
Okay.
And you know, I feel great. I feel good. But the reality of the whole situation, I am a man. If I do not take my insulin, life is going to fail.
Okay.
And you know, my mother died from diabetes. My father died from it. I have a auntie right now, she has 1 leg like me.
Right leg as well?
Yeah.
Right here.
4 of her brothers, 3 of her brothers.
Are they basic or they lose the leg? Right leg?
3 of her brothers died from diabetes.
Okay, sorry to hear, man. Alright?
So it runs both sides of the family. But it's something where you can live with if you have the principle. Diabetic or being diabetic is being, how you beat it, how you live with it is a principle. Okay. I never have the principle.
Okay. Discipline.
The discipline to maintain the strict regulation, the dietary formation, and the exercise and
insulin,
and all of them things, you know, because diabetes, you know, because if you eat vegetable, exercise, no red meat, and you know, to me, avoid the fridge.
Okay, alright.
Yeah, that is something we need. Me avoid anything cold.
Alright. So just tell the viewers how they can be able to reach you for booking.
Well, if you want Major Mackerel, you can link on in famous Music Town Entertainment. See, now you can send me an email at realmajormackerel@gmail.com or catch me on Facebook, Garfield Major Mackerel Dixon. See, or you can link my manager, Mr. Campbell, 876-854-2321.
Okay.
See?
Alright, thanks very much for coming.
Well, Doctor, give thanks for the time.
Yes.
And people out there, may I beg on you, listen to the doctor.
Good.
This man know what he's saying. And, you know, I messed up, alright? Because I know people with diabetes longer than me, and they are living better than me right now.
Okay.
Alright? It's a principle. But first and most of all, listen to Dr. Samuels.
Yeah, man, definitely.
They go know. Listen to him. Yeah? And when you don't have no complication, don't follow people about the bush, they do this and this do that. And the same thing with your follow and see what the bush them do. Because the man them will go bush, the man them will sell the bush, don't go to school for it. They are not educated by about bush and bush medicine. Them educate themselves or whatever, them tell themselves, that is what them believe. If them say 1 + 3 = 5, then believe say 1 + 3 = 5 and not 1 + 3 = 4. Or 1 and 3 are 13. Alright, stop follow them people that say them are roots man and herb man. See, if you have a certificate for show you when you go to school fee, you can work with it. But anybody that don't have a certificate, listen to what the doctor said. Rasta man are telling you this. And the herb man then make me lose my foot. And then me follow, stop take the doctor medication and I take for the medication. Alright? So I beg the island people, you don't have to be like me. Diabetes cannot cure. It can be treated. And if they have the cure for it, it don't reach around the poor people section yet. Alright? This Dr. Samuels can help you. I'm not going to tell you say if you are dead, it can save your life, but it can help you live longer with it. Because they don't have no cure for it yet, and if they have a cure, we don't know. So people, love on yourself, you know, and love on yourself more than anything else in this world. And don't fight for wealth. Fight for health, and then you go for wealth. Because enough man go for wealth and don't have no health. And like butter and salt, so they melt. So me I beg on the people, take care of yourself, consult the doctor, work with him. Alright? He's a great man, well-educated young man that understands the curriculum of life, the circle of life, and the medical fields. So ladies and gentlemen out there with uncontrollable diabetes, all of who have diabetes and I drink alcohol, and I eat the things they want enough to eat. It's nice for now, but when the table turn, it's going to be something different. So I beg you, Senior Garfield Dixon and me on the DJ, Major Mackerel, and me on listen to all of them years. The Pretty Looks Done, Dirty Bongo, Bang Bang, Miss Getty, Coca, Labamouth, just to name a few of my songs. 1 foot me up just because we never listen to the doctor and we never follow the right protocol. So don't be a victim like me. Be a victor. Yeah? Listen to the doctor, me a beg you. Stop follow them bushman, because they don't know what they do.
Alright. Alright, Major Mackerel.
Respect, sir.
Again, so for more informative content, remember to like, share, subscribe, and leave a comment on this video. And you can always contact us on the information on the screen, and also Major Mackerel had shared his contact information before as well. We'll also put them on the screen. And then for more informative content, we have a video coming out every week. And stay tuned, and you can free to contact us on Facebook, Instagram, TikTok, etc. for more informative contents on life, sickness, and death. Alright, thanks very much for coming again.
Respect again, doctor, and I hope you save some more life.
Thank you.
Diabetes is the silent assassin, because anytime you know you have it, it is too late. Alright? So while you have it, I beg you, just consult this at Dr. Samuels. Please.
Be sure to subscribe for more informative contents on life, sickness, and death.